Hello, my name is Victor Han, and this is my Parkinate project. This video is meant to explain why the project exists, how it evolved, and how it shaped me as a student and engineer. Parkinate represents my attempt to use engineering not just to solve a problem, but to address a real gap in healthcare accessibility. I love my grandma, who has been an integral part of my life. However, starting years ago, her Parkinson's symptoms have gotten worse over time, bringing a lot of inconvenience to her life. She's not the only one living with Parkinson's. There's a 20,000 Parkinson's disease population in Wisconsin alone. In addition, the number is around 1.3 million people in the United States, and its number will rise to 1.5 million in 5 years. The combined direct and indirect cost of Parkinson's is nearly 60 billion per year in the United States alone. I really wanted to do something to help. The problem is that there is a lack of accessible and affordable diagnostic tools. Traditional diagnostic methods often rely on in-person consultation with specialists and expensive imaging, which are costly, time-consuming, and not accessible in many parts of the world. While existing rehabilitation devices are needed, they often have problems such as having complex structures, posting safety problems, lacking adaptive design based on the level of patient rehabilitation training, and they all have mono features, which are usually not enough for patients. Therefore, I developed a software called Parkinate. Now, Parkinate offers a unified and accessible alternative to hospital-centered evaluation and rehabilitation. Instead of focusing on a single symptom or modality, the system combines body motion analysis, speech analysis, and rehabilitation feedback into one platform. The goal is not to replace clinicians, but to support earlier detection and more continuous care. Now, this slideshow shows the system architecture and app interface. The diagnostic portion of the app processes motion and speech data, while the rehabilitation interface allows users to interact with the device in a controlled and adaptive way. The separation between diagnostic analysis and physical rehabilitation was intentional. It allows the system to scale while maintaining safety boundaries. Designing this architecture forced me to think beyond algorithms and consider data flow, latency, and user interaction as equally critical components. Now, for motor symptom detection, Parkinate analyzes body motion to identify tremor frequency, irregular movement patterns, and kinetic instability. Now, rather than relying on a single snapshot, the system focuses on consistency and trends. This approach aligns more closely with how clinicians observe Parkinson's progressions over time. Speech analysis adds another critical dimension. Parkinson's often affects vocal control early, yet speech is underutilized in many diagnostic tools. By analyzing disruptions in form and frequencies, Parkinate captures subtle neurological changes that may not be visually obvious. Here, you can see a demo of how the system functions. The Parkinate system has been successfully deployed on web, gaining over 1,200 users to date. The rehabilitation module was designed with simplicity and safety in mind. Rather than complex mechanical structures, the device uses sensor-based feedback, adaptive resistance, and controlled motion. The intent is to support gradual motor recovery while minimizing risk during unsupervised use. Patients will be redirected to a second app page, and the first feature of the device is a finger bending training. Patients are able to adjust the finger bending angle, speed, and cycles on the app. The angle's reach will be detected by sensors and printed on the app. The second feature of the device is tremor rating. When the patients press the button, their finger will be tracked over a period of time, and a percentage of tremors will be printed on the app. Now, Parkinate began as a personal response to Parkinson's disease, but it evolved into a system-level solution once I recognized broader accessibility gaps. Within the field, Parkinate aligns with a larger shift toward low-cost, at-home, AI-assisted healthcare. Now, the consideration and integration of biomedical knowledge, AI, and mechanical design accelerate this overall process, and this is the trend in recent days. Looking forward, I plan to expand validation, test across more diverse populations, and strengthen community partnerships to ensure the system can function beyond a controlled environment. Parkinate represents my growth as both a researcher and a person. It shows how curiosity of mine became technical tool, and a personal motivation became social commitment. As a student, this project fundamentally changed how I think about engineering. I moved from simply optimizing performance to prioritizing user-centered design, ethical deployment, and long-term impact. I believe that by harnessing the power of cutting-edge technology, we can bring proactive healthcare solutions to the elderly.